Dan, what about you? You're on mute.
Here.
You.
There we go. I think we could have used another 2 hours for question and answer. I think what impressed me the most is how can we leverage what we know about respiratory protection, about what we have learned over 100 years of respiratory protection, about protecting people from a known contaminant, where there is a known acceptable level of something in the lungs. Now, with public masks, none of that certainty is there. So how do we take what we have learned? How do we take what we know about providing personal protection and translate that into a public health, more of a public health issue than an occupational issue? I think we need to look at what Jim said about there are some controls beyond respiratory that are part of this. Social distancing, for example, is an administrative control. Do we incorporate that in any sort of standard or guidance that we put out about facial protection for public use? I think we've gotten a very good baseline understanding of where the gaps are, as well as what work has been done in this area. And I think it'll give us it'll provide an excellent basis for moving forward. But I think time is very critical. The schedule that I'm accustomed to for developing standards is pretty lengthy, with a 5-year renewal of a standard and things like that. I don't think we have that kind of time. We need to get something together. I heard a lot of speakers say, don't let perfect be the enemy of sufficient, of good. We need to get to work and get something out that will provide not only information to the public of what they need to do to continue to protect themselves, but also information to the suppliers, to the distributors, to the sellers, about what their respiratory products, their community masks, if you will, need to do, and how do they measure that performance, and how do we communicate that measurement.